My Autoimmune Fix presents Optimal Thyroid.
Hi everyone, my name is Dr. Stewart Gillespie. I'm a certified functional medicine practitioner.
And my name is Dr. Jimerson. I'm also a certified functional medicine practitioner. First of all, this lecture is not intended to treat or diagnose your issues. You really need to be working with a practitioner one-on-one for you to even be able to expect that. So please keep that in mind as you are watching this.
All of the statements that I made today are backed by peer-reviewed literature and, most importantly, common sense.
This is going to be an out-of-the-box seminar. You are going to hear a perspective that you have never heard before. You are going to ask yourself, why hasn't my doctor told me this? This is going to change the way that you think about health and disease. You don't learn about this in medical school, and we didn't learn about this in chiropractic school. This is a result of postdoctorate education, mentorships with some of the finest doctors in the world, thousands of hours of studying, and every week we strive to learn the latest research on a whole host of topics.
Unfortunately, most information that you're given to by your doctors is archaic. Solutions for a bygone era. We're advancing every week with new technology and new lab tests. Conventional lab tests and ranges for lab tests do not go deep enough in order to find your underlying problems. This often leads to misdiagnosis, frustrated patients, poor results, and a lifetime on medications. It's time for a new approach, a new way of thinking, a whole body approach, and that approach is called functional medicine.
Diseases are in reality only symptoms. They're the tip of the iceberg. Conventional medicine is about finding disease, diagnosing disease, and treating disease. Disease is only a symptom. Our approach is different. It is a patient-centered, whole-body approach. And from our experience, we know disease results from a poor internal environment from underlying causes. Underlying causes such as inflammatory imbalances, immune imbalances, digestion issues, hormonal imbalances, mitochondrial dysfunction. All of these things are more of the why. For us, the diagnosis doesn't explain the why. For instance, if you came in with arthritis, it only lets us know that you have painful and inflamed joints. That's only a symptom, and it doesn't tell us why the arthritis happened.
So really, through this webinar that we're giving you today, through our expertise, through our thoughts, we're trying to give you a choice, to give you a new way to go. So are you going to be stuck in old dogma and old routines that just treat symptoms, that just band-aid your problem? Or do you really want to find the underlying root cause? A new way of thinking, a whole body approach. Remember that doctor comes from the old Latin word for teacher. So we're trying to educate you guys, trying to empower you to take control of your health. Every day in the office we see frustrated patients who are told their problem is a result of old age, or they're unlucky, or they have a genetic problem, it's a family history problem. Maybe it's in their heads, maybe they're just depressed and they put on antidepressants. So please come with us, take control of your health. We're going to find a new way and help you through this disease process, and in this particular case we're talking about thyroid conditions.
Finally, we're getting onto the thyroid. Poor thyroid symptoms. Not everybody comes in and says, "Doc, I've got an issue with my thyroid." Sometimes they come in with fatigue, cold sensitivity, constipation, dry skin, unexplained weight gain, puffy face, hoarseness of your voice, slowed heart rate. There's all different things. It could be every single one of them, or it could be just a few. Remember, these are just symptoms. They don't exactly explain why the issue is going on. We've got to be like medical detectives. We've got to figure out the underlying pathology. So you can come in with elevated blood cholesterol and stiffness, pain in your joints, and we're not going to treat the symptoms, we're going to treat more the why of the condition.
So I'm sure that a lot of you come in with some of those symptoms, maybe all of those symptoms, and you're not too sure where to go. So the first sort of thing that we sort of look at blood work. And how often are we told every single day that, Doc, my blood work is normal, don't worry, there's nothing on there that sort of is pointing to a problem. Trouble is, if I were to tell you that about 85 to 90% of people are actually normal on their blood work, it just means that they don't have a pathology, they don't have a disease state, but they're still having problems because blood tests aren't really looking at functional problems or everyday problems, they're actually sort of looking for disease processes. So sometimes the disease processes don't show up for at least 7 to 10 years before they can show up on a blood work, but you're still running around with everyday subclinical functional problems that have to be looked at. And sometimes there are clues in your history that can sort of tell us what's going on. So we're not curing disease, but we're actually trying to prevent something from happening. So why are you normal on your blood test? You really have to go back in time, go back in history and find out how these ranges for your blood were created. These were done decades ago, and they're really a statistical analysis. So they were taken on a normal population, not even a sick population. They were taken with a bunch of normal people. And what they did was that they did it like a standard deviation curve, like a bell curve. So they decided that if you were within 2 standard degrees of normal, that was you would sort of be in the under range and the top range of your blood test. So really, you have to sort of be outside of 2 standard degrees of deviation in order to be abnormal on your blood work. So you have to sort of be in the bottom 2.5% or the top 2.5% out of normal. So that really sort of says to us that only 5 to 6% of people are actually abnormal on your blood test. And in those people, they have a disease state. So are we really saying that 95% of people out there are actually normal? I don't think so.
We see this in the office every single day. Doc, my blood work is still normal. How come I feel like crap? So what happens if you take all these symptoms and you go to your doctor? He's going to put you on a medication, and the medication is, in effect, duct taping the symptoms. It makes you feel great, sometimes for weeks, sometimes for months, but again, it's just duct taping the issue. It's not really solving the underlying cause that got you there to begin with. It's like coming home and you've got that leaky ceiling. You call in a couple of different contractors. One guy is going to put duct tape up there. See? Problem solved. Another person is going to take that step back and say, you know what, there's a bigger issue going on. We've got to take a look at the roof. There's something deeper, a bigger, more underlying cause going on. So how do you know that you've actually fixed the problem? Try taking the medication away. See how you feel. It hasn't really actually fixed the why of the issue. It's just duct taped it.
So here's our solution. Our solution is a whole body approach. So if you're looking at thyroid problems, you can't just look at TSH. So on your blood screens, all the doctors look at is TSH. Sometimes there's some T4 in there, sometimes there's some T3. If they're slightly progressive, they might look at those numbers. But really, most blood screens just look at your TSH value. TSH stands for thyroid stimulating hormone. It actually comes from the brain, something called the pituitary gland. And so it doesn't even come from the thyroid, but what it does is stimulates your thyroid to make T4. Now T4 is your inactive form of thyroid hormone, so it goes into the blood like all hormones do, and it's inactive. It doesn't actually get put to work until it reaches its end organs or its target tissues. Where does most of this T4 get converted into something called T3? Most of it occurs in the liver. And also 20% of that actually occurs in the gut as well. So 80% of your T4 to T3 conversion happens in the liver and the gut. I ask you, what happens if you have a liver issue? What happens if you have a gut issue? Don't you think you're going to show up with thyroid symptoms if you have a liver or a gut issue because you're not converting T4 into T3. This is a really important point. So when we go through someone's history thoroughly, we find out, have they had liver problems in the past? Have they had mono? Have they had hepatitis C? Do they have detox issues which is going to cause their liver to be functioning improperly? Do they have a fatty liver? If you have a fatty liver, you can't convert T4 into T3. What about IBS issues? How many people out there have thyroid problems and IBS issues? Because T4 and T3 is converted in the gut 20% of the time. And so if you have a gut issue or a gut infection or any sort of inflammatory disease like Crohn's or ulcerative colitis, you cannot make that T3. And therefore you're going to come to the office with thyroid-like symptoms, not because you have a thyroid problem, but because you have a gut problem. Now the other piece of this puzzle is something called reverse T3. So reverse T3 is 20% of your T4 hormone is converted into reverse T3. Reverse T3 is kind of like the brakes on the system. So remember, your body works in balance. It sort of stimulates and it sort of puts the brakes on. So is your thyroid problem a problem because you have too much brakes on the system? You have too much reverse T3 in the system, so you're braking too hard? Or is it the problem that you can't accelerate? You don't produce enough T3? I know it's fairly complicated, but as you can see, I'm just trying to give you the whole body picture so you understand that TSH is only a small piece of a very complex puzzle.
So in order to evaluate the pathway in the previous slide, we have to order a complete thyroid panel. And guess how much of this panel is typically ordered? Well, TSH is always ordered and ends up being a part of everybody's blood screen. And if you're lucky enough to find an endocrinologist, he just might be forward-thinking enough and order the first 3 values. But to be honest, you need to order a full thyroid panel. And one of the values with the biggest clinical significance is TPO and anti-thyroid globulin antibodies. And we're about to discuss this in just a couple of moments as to the extreme clinical significance that this value has on your health.
So I hope with this information, you're really getting the idea that this is really a whole body approach. The thyroid is not an individual gland. It communicates with every single cell in the body. There are thyroid hormone receptor cells in every single cell in the body. So guess what? The thyroid isn't just an individual gland. You have to look at the whole body in order to figure out why the thyroid is dysfunctioning. And that goes from the brain, which secretes TSH, all the way down to the liver, which actually converts your T4 to T3. So many things are involved. So let's assess the brain from this point of view. Look at the factors that might affect the brain. So neurotransmitters, which are kind of your brain hormones, they actually sort of help the pituitary gland secrete that TSH, which is really vitally important to stimulating the thyroid gland. Methylation is MTHFR. So you could have a liver problem which might affect the brain, which will then affect the thyroid. Gut infections. Gut infections, they affect the brain. So leaky gut, leaky brain. We see this in autistic children, that they have problems with their guts. And so if you have a problem with the gut, you can have a problem with the brain, you can have a problem with the thyroid, but it may not be a thyroid problem. It's just a symptom of an underlying gut or brain condition. Blood sugar imbalances. We've got to get that blood sugar under control. Vitamin D. How many people are low in vitamin D in their blood panels? So the simple answer there is just to sort of increase your vitamin D, but you will present with thyroid type symptoms if you have a vitamin D deficiency. Other nutrient deficiencies which affect the thyroid are things like selenium, zinc, iodine, iron, B vitamins, vitamin E. So again, if you assess someone from their nutrient deficiencies, you will really unlock the mysteries of why the thyroid is not functioning properly. It's a really sensitive gland. It's sort of affected by many toxins in the system, pesticides, insecticides, heavy metals, huge interplay when it comes to thyroid conditions. Stress is extremely important. So many people have thyroid symptoms after a period of stress, and that stress could be a significant trauma, like a car accident. It could be sort of an emotional stress, like sort of divorce or losing a loved one. Inflammation is like an inherent sort of under a stress in every single part of the body, which could be caused by an allergy, it could be caused by gluten or food intolerance. Any sort of inflammation can actually sort of stress out that thyroid gland. So this is what underpins functional medicine. We take a whole body approach to finding out what is the underlying cause of your thyroid issue.
Again, symptoms versus causes. There are so many things that can happen in the body that can cause stress to the thyroid gland. And the issues that arise are always symptoms. And when you treat symptoms, you will always end up treating your symptoms. You need to treat the cause if you want to actually fix the issue. So basically, toxins can block your thyroid hormones. That BPA found in your water bottles, plastic containers for food, it's found in dentistry. You're being exposed to toxins hundreds of times in a day. PBDE, flame retardants in your clothing, bedding, it's found in buildings, electronics. Bromines are found in bagels, fluoride in your toothpaste, chlorine in your water. All these things actually compete with iodine, and iodine is what forms T4 and T3. And another thing people didn't realize is caloric restriction. Many people have gained weight from poor functioning thyroids, and you gain the weight and you're trying to solve the solution, so you try to start cutting the calories, but if you cut the calories too low, you actually start blocking the conversion of T4 to T3. And so basically you start making a poor functioning thyroid even worse by cutting out the calories too far.
So about 85% of my patients who come in the office always report a stressful event as a precursor to their ill health. And this is the same for thyroid conditions as it is for any sort of autoimmune type conditions. So if you can think about stress in different ways, I mean, the body interprets stress in different ways. And this could be an emotional stress, it could be a physical stress, it could be taking some sort of corticosteroid, it could be an allergy, an allergic reaction to something, it could be gluten that causes stress or inflammation in the body. So stress in the body presents as many different ways. Even over-exercising, that high cortisol which you get from sort of long sessions of cardio, is really quite destructive to that T4, T3 conversion. So remember, you can get a thyroid problem because you have too much stress in the body. So looking at your adrenal stress panels, looking at your adrenal hormones is a really important part of really being a detective and uncovering some underlying causes to an improper functioning thyroid. So what are the significant effects of low T3 output? So T3 innervates every single cell of the body. It's the active form of thyroid hormones, and it actually sort of puts the cell to work. But some other things that we probably don't know about T3. T3 is actually required for gastrin secretion in the stomach, so it's actually very important actually sort of increasing stomach acid and breaking down your food. So how often do you see sort of thyroid patients come in with one of their chief complaints is IBS or hypochlorhydria or inability to break down foods, and therefore they feel bloated all the time, especially after meals? That's a really important sort of T3 output significance. Again, it's not a thyroid problem, it's actually a stress issue. Another thing, people often appear with high cholesterol with a thyroid problem. Again, T3 is required for the breakdown of LDLs. So quite often, as your blood work comes in, when all they measure is TSH and cholesterol, they always go after the cholesterol problem rather than the T3 problem. Really quite significant here, and you put on a lifetime medications of statins when it's not really a cholesterol problem, but actually a low T3 syndrome, otherwise known as euthyroid sickness.
So through this education process, we're trying to give you the tools to think outside the box. And so also, mastering your thyroid, low saturated fat, low carb diets. When you have thyroid conditions, it often results in weight gain everywhere. And people will jump on low fat diets and low carb diets. And often we find ourselves attempting to diet the weight off, and ultimately it exacerbates the issues with the thyroid. And a side note, we are a huge fan of low carb diets, but they're only worthwhile once you fix the underlying hormonal issues that need to be addressed. You can see that low estrogen decreases T3 and T4 and increases TSH. A couple lines down, you see leptin and insulin resistance. And the big picture with this is that other hormones can affect your thyroid hormone. So when you just jump on a medication and start treating the symptoms of thyroid issues without going after these underlying causes, you're always going to be treating the symptoms, and you're setting yourself up to feel like crap for the rest of your life while still taking medications that aren't ever going to fix the issue.
And even though thyroid actually sort of presents in women more than men, I mean, guys can't forget that low testosterone, low growth hormone, particularly fantastic male hormones can actually affect your thyroid gland. Trouble is, when do you see testosterone and growth hormone in your blood panel? Right, you only see TSH. So if you have a TSH that's out of value and you're not even assessing testosterone or growth hormone, you're just not fixing underlying causes. Alcohol is a big factor. Remember that T4, T3 conversion in the liver. So if you're an alcoholic drinker like red wine most evenings, you really are going to affect your T4, T3 conversion. Presents as a thyroid problem, but it's actually a liver problem. So lots of things in place. Heavy metals, toxins, we talked about this before. Cruciferous vegetables, very goitrogenic because they actually sort of increase the size of the thyroid. Soy products, soy milk, tofu, these actually sort of compete with thyroid hormones, so they actually slow down thyroid. Other big things are sort of tea, caffeine, stimulations, all these sort of things will sort of speed up thyroid, adrenal problems, can actually slow down your thyroid as well. So, big picture, think outside the box, there's other things going on here besides your thyroid.
It's important to note that nutrient deficiencies can affect every organ in the body, but the thyroid is particularly susceptible to these nutrient deficiencies, as IBS and constipation is concurrent with the thyroid. And dysbiosis leads to improper food digestion and assimilation as well as nutrient absorption. So it's really important to get a nutrient assessment test. A lot of people end up trying to take iodine for thyroid situations, but in certain autoimmune conditions such as Hashimoto's thyroiditis, it's actually contraindicated to take iodine. So that's why it's very important to actually test and not guess, and you don't want to take random supplements to try to clear up a thyroid. You want to seek the actual cause.
So as you see from this previous slide, that zinc and selenium is very important for the whole thyroid pathway function. In fact, zinc is involved in almost every single pathway. Certain anemias are particularly destroys the thyroid. Iron deficiency in particular. Iron is needed for TPO, which is a very important enzyme in the whole thyroid pathway. You can also get B vitamin deficiencies or B vitamin anemias, even macrocytic anemias, which is a B12 anemia. They can actually affect the thyroid too. Chromium is very important in blood sugar regulation, so anybody with a diabetic situation or reactive hypoglycemia can also get a thyroid condition. Trouble is, if you go after the thyroid without fixing the blood sugar condition, you will never get resolution in the thyroid case. Copper, vitamin A, also essential vitamins. Really important to get the nutrient assessment test. If you just throw vitamins at these problems without actually sort of assessing whether you're deficient in these vitamins, you can actually sort of take too much of a certain type of vitamin. So make your sort of protocol more customized by getting nutrient assessment test, and then you can sort of customize your pathway.
This has got to be my absolute most favorite part of the presentation, that Hashimoto's thyroiditis. This is 90% of all thyroid conditions. This is very rarely tested for. This is awesome stuff. What do you think, Stu?
Yeah, I mean, absolutely. I mean, autoimmunity, Hashimoto's is an autoimmune condition. It's really poorly handled by conventional medicine. They don't really get to grips with what or understand what this is really all about. Autoimmunity is all about fixing the gut, fixing the immune system, balancing those two things in order to fix a thyroid condition. Thyroid hormones are not going to work for this type of condition. It's a very serious condition. It takes a lot of sort of detective work to find this out. Blood testing is the most important part of this. You have to find out, are you dealing with a thyroid condition which is caused by nutrient deficiencies or caused by stress, or are you dealing with a full-blown autoimmunity? So this is where the antibody testing is crucial here. And so find out, is it an autoimmune condition? If it is, there's a completely different solution for this type of condition than for the other types of thyroid conditions.
And this is absolutely exciting, because if you can figure out the why, you can actually treat it and fix it.
So anybody out there, you really have to get your doctor to get a full thyroid panel, and this has to include your antibodies. This is thyroid or TPO antibodies and also thyroid globulin antibodies. If you know your immune system is attacking your thyroid, you have to calm the immune system down. So this is why you have to find out, are you dealing with an autoimmune condition? It's crucial to fixing one of these cases. And we've seen about 3 or 4 cases just in the last couple of days alone where thyroid panels have been done, don't include the antibodies. The first thing we do when they come into the office, we send them out for the antibody test, and it usually 90% of the time comes back as a positive antibody test, and then it's a completely different problem, and we go after that gut and the immune system. Please do this because you don't want to be on a lifetime of thyroid medications and just treating the symptom rather than treating the underlying cause.
And once you calm down the immune system, this is when you get to figure out what actually set off the immune system to begin with. And it could be anything from gut infections, heavy metal toxicity, stress, viruses, parasites, leaky gut syndrome. And the key is find what actually set it off and you actually fix the issue. And so here we are again. This is where you guys are going to have to make a choice. You follow the conventional method and you take the immune suppressants, you take thyroid hormones, or you step outside the box. You treat the why of the condition, you treat the whole body, and you fix the condition once and for all.
So this is a typical conventional medicine approach. Is once this sort of thyroid numbers eventually become out of range, don't forget you're normal until those numbers get out of range. And once you're out of range, you're in a disease state, as most conventional doctors think you are. And so in disease states, they usually give you a drug protocol to fix that. Drug of choice is Thyroid, but there are other drugs out there that sort of do the same thing. But this is pretty much a T4 synthetic thyroid replacement hormone. And guess what? You will feel better. There's no doubt that Thyroid will actually sort of help you with thyroid conditions because it's treating the symptom. And that's what drugs do. They treat symptoms. So you will feel better from this. Sort of things you should watch out for is maybe 3 months down the road, you start to feel like you're sort of regressing or you're going back to what you felt like before. You might go back to the doctor and sort of say, hey, I felt great in the first few weeks. I felt great on Thyroid, but I just started getting worse. And so the doctor will say, well, you know what, maybe we should just up the Thyroid. Maybe we should just give you more of it because, giving you more of it will actually make you feel better. And so you're sort of on this sort of pathway of sort of continue taking thyroid medication, and you're pretty much on this for the rest of your life. Trouble is your numbers don't really change much. They might sort of flip back and forth. You might go hyperthyroid and then back to hypothyroid and flip back and forth again, and they might sort of change the dosages. But essentially, this really is only sort of masking tape the situation, and in order to sort of figure out sort of thyroid problems and finding real solutions to thyroid problems, you really have to go under for the underlying conditions. Other conventional methods for treating a thyroid problem is actually sort of surgery, actually remove the thyroid itself. This is really typical in sort of other problems like cancer and sort of cysts or maybe even growths on the thyroid or benign growths, where sometimes surgical intervention is necessary. And these are one of the alternatives in treating sort of thyroid problems as well. Again, cancer to the thyroid or even sort of cysts on the thyroid, usually caused by some sort of estrogen dominance situation going on, usually some sort of hormonal imbalance. Cancer, they're finding these days about 85% of cancers is due to environmental conditions and internal environments and poor internal environments causing those genes to be set off. So again, sometimes it's necessary to remove the thyroid, but always look for underlying causes, even in terms of sort of cysts on the thyroid and also thyroid growths. Autoimmunity has really come to the fore in the last sort of few years. A lot of sort of research has gone into it by MDs and also sort of alternative doctors as well. The biggest sort of MD that's sort of really sort of taken a hold of this is a guy called Dr. Fasana, and he's sort of taken autoimmunity, and he said there's actually 3 things that you actually need in order to figure out what is setting off an autoimmunity. The first thing you have is you always have a genetic tendency to have autoimmune disease. And the second thing is you actually need some sort of trigger that sort of sets off this genetic profile, something called epigenetics. So there's always a trigger, and whether that's sort of gluten, whether it's a food intolerance like that, or is it a mold or heavy metal toxic overload that changes your internal environment. Stress. So many times in the office, as we said before, stress is always the precursor to a lot of situations. And stress, remember, sort of lowers your stomach acid. Stress sort of tears down your immune system, tears down the protein covering of the gut wall. And so it's no wonder that stress or adrenal fatigue can actually sort of set off an immune system or a leaky gut syndrome, which sort of underpins any sort of autoimmunity. And the trifecta of that thing is a leaky gut syndrome. So you have to have holes in the gut for the immune system to be set off. Something has come through the gut, gone into your blood, and set off the immune system. That is what autoimmunity is all about. So it's genetics, it's triggers, it's leaky gut. Finding solution to those is finding the solution to your Hashimoto's problem.
So it is true, you can have a family genetic component, and a lot of times doctors will say, you know what, it's just in your genes, your family members have it, you're going to have it, and it can be in your genes, but again, as Dr. Gillespie had said, you need an actual trigger, an environmental trigger to actually set off of those genes. To actually for those genes to activate and to essentially cause these issues. So what exactly is leaky gut? I found a great picture here that demonstrates that no, this actually isn't leaky gut. We're going to show you in a second here.
So in order to find out what a leaky gut syndrome is, or to figure out what it is, you have to understand what the digestive system does in the first place. So the digestive walls, or the cells within the digestive system, only allow through things that it wants. It takes nutrients from your food, and it sort of processes those and assimilates those, and it sort of takes it to the target tissue that it needs to. It doesn't allow things in the system that it doesn't want, and that's the biggest important thing. So these cells within the digestive system have very tight junctions, and they do not allow things in unless they want to. Trouble is, under certain types of situations, and we'll go into this a little bit later, those tight junctions seem to swell, and when they swell, they seem to expand, and those tight junctions aren't tight junctions anymore, but they're very loosely held junctions, and so you start getting gaps within cells of the digestive system. So the problem is, things start to leak from the inner lumen of the gut through the cells and into the bloodstream, things that shouldn't be there. So your immune system sees these as foreign objects, and it starts attacking these things and start producing antibodies. Trouble is, these antibodies just doesn't go after these food particles. You're somewhere along the way, and this is not quite understood yet, but somewhere along the way, antibodies are produced to your own tissues, and this could be to the thyroid as Hashimoto's thyroiditis. It could be to your nervous system as MS. It could be fibromyalgia type systems. It could be something as infertility. It could be like antibodies to your ovaries or to your testes. So autoimmunity is huge. The underlying cause of all autoimmunity is a leaky gut syndrome.
So what actually causes leaky gut, what actually takes those tight junctions and actually starts to stretch them apart, it can be a bunch of different things. It could be every single one of these things, or it could be just one of these things. So food intolerances, stuff like gluten, medication, non-steroidal anti-inflammatories, bacteria, you eat something bad on vacation, having poor diet, exposing yourself to yeast, even doing surgeries. Maybe you live you have a high stress environment. You're constantly at stress at work or at home. Different hormone imbalances will give it issues. Hypochlorhydria, lack of stomach acid. Eventually, as we start aging, we produce less and less stomach acid, and there's a bunch of different things that can create low stomach acid. But basically, all these things start weakening those tight junctures. And again, as Dr. Gillespie mentioned, that when you're eating when you eat food, tiny little particles leak through that stuff into your bloodstream, and your body sees that stuff as an attacking invader and just starts attacking itself, again, setting off that massive autoimmune and inflammatory response.
So a lot of the time we get told, Doc, I mean, my diet's really clean. I sort of eat organic. I sort of go grass-fed meats, grass-fed butters, really clean diets, and I don't really have bad things. I don't put bad things in the system. When you have, this is probably sort of, I mean, this is always isn't always diet and food related. As we said, I mean, pharmaceuticals can sort of play around with this. Even sort of contaminated food can play around with this. So even if you're eating clean food, you can be sort of contaminated in some sort of way. The thing is that when you're producing antibodies, you definitely have a leaky gut. And going through someone's thorough history, even sort of certain testing these days where you can actually sort of test and sort of see what you have in the stomach that's causing a leaky gut. And this way, once you find out what the cause is, you can just remove that trigger or fix the underlying cause. And it's different for everybody. So you can't give the same approach to everybody with an autoimmune condition. Find out what's causing it. Is it a gut infection? Is it contaminated food? Is it a virus? Fix that. Take the appropriate measures to fix that, and then you have to repair the gut after that. It sounds simple, I know, but it's actually quite a long 2-month, 3-month process in order to fix that gut condition. And then after that, you sort of have to fix hormone imbalances and then calm the immune system down. So you're looking at 3 to 6 months worth of work here.
And I know we keep saying this, throughout the entire seminar, but you gotta test. You can't guess. And the reason why I just keep trying to hammer that home is because we just see so many people that everybody is an internet expert, and we read different articles, and this is good for the thyroid, that's good for the thyroid, et cetera, and you start doing a hodgepodge of different supplements and different things to try to fix the symptoms of the thyroid instead of, again, fixing more the why in terms of what's actually setting off the thyroid. So, treatment plans have to be based upon a full, comprehensive history. And that's the only way to figure out more the why. And if you can fix the why, then you can actually treat the situation. And everybody's treatment plan is not going to be the same because, again, you have to determine the triggers, the foods, that are setting off the immune system. And that's why everybody's plan ends up being customized for their condition. Kim is a mother of 2 young children that came to us with some thyroid issues. She had gone on a frugal diet that she had read about. She had been on Synthroid for quite some time. After a month on her new diet, her body developed a severe rash all over the place that she had never had before, and she was also starting to get some right-sided abdominal pain. It was up to us to figure out whether or not this was a diet issue causing all of the above, or if it was a full-blown autoimmune condition. Her endocrinologist had never ordered a full thyroid panel, and we decided to. The lab showed a positive TPO antibody, which completely changed our outlook on the situation. She had to completely change what she was doing. We knew that we had to go after the gut and the immune system to help solve her problem. But within 1 week of being on our protocol, her rash disappeared, and within 2 weeks, she voluntarily took herself off Synthroid. 6 months later, she continues to send us updates that she is feeling better than she has in years.
So we wanted to go through a few slides here. So giving you sort of peer-reviewed literature. This isn't our information. This is actually out there. We found this, and this is sort of peer-reviewed journals, Journal of Medicine even, medical doctors talking about this, scientists. They know that there is an intestinal permeability out there. So gliadin is on the first thing. So wheat products actually causes intestinal permeability in celiac disease and even non-celiac disease. So celiac is a genetic autoimmune condition. You can actually get gliadin actually causes leaky gut even in non-celiac disease. Is basically what that is saying. Antibiotics changes the gut ecology, so it changes your good bacteria and your bad bacteria, the ratios of both. And so bad bacteria can actually cause swelling in the gut, causes that intestinal permeability or increased IP. That's from the Journal of Medicine. Stresses, so we're talking about stress, we're talking about hormone imbalances, can actually sort of change your gut. So it changes your stomach acid in your gut. It actually sort of increases your IBS symptoms through a sympathetic response, which shuts down the way your gut actually sort of moves, the way the gut actually sort of gets rid of toxins. Stress is a huge player here, and if you do have stress as one of the underlying causes, fixing those adrenal fatigue, fixing those adrenal hormones is huge in terms of sort of fixing any sort of autoimmune condition.
And as you guys can see here, this is from the World Journal of Gastroenterology. Increased intestinal permeability is observed in about 50 to 70% of long-term non-steroidal anti-inflammatory users. So how many of you take an aspirin a day for your heart? How many people have worked out too hard and relied on ibuprofen or Advil? When you start relying on that stuff, you start wearing away, and you start increasing that permeability of the gut. You start stretching out those tight junctures, and again, that's what is the ground zero of these autoimmune conditions, is stretching out those cells, which eventually allow those food particles to leak all the way through.
If we go back in history, we've known this for a very long time. I mean, look at Hippocrates. I mean, this is just a quote from his. He found out all disease begins in the gut. Basically, 80% of your immune system actually hangs out in the gut. And there's a reason for this, is that your body is trying to protect you from anything that gets through the gut into your body. And so the problem is that when this immune system goes out of control, and this can be caused by many different stresses in your life, but autoimmunity is an immune system which is supposed to be working normally, just cannot switch itself off, and it starts attacking your own tissues. Always begins in the gut. This is where the immune system is. The other part of the immune system is actually in the brain, and so, quite a lot of this stuff you hear about gut-brain connections. If you have sort of leaky gut problems, you start to get brain issues, brain inflammation, and sort of brain fog, and sort of memory issues, Alzheimer's. So again, these things are sort of brought about by an improper internal environment caused by a problem with your gut bacteria and a problem with the leaky gut syndrome.
Remember, a leaky gut is a leaky brain. I really hope we've been able to get across how we utilize an integrative approach to solving what is, after all, a complicated issue. It's really time to stop chasing symptoms and get a hold of some of the underlying issues that have been ignored for so long.
If you feel this has been of value to you and were interested in working with us one-on-one, please follow the links below in order to sign up for a free 15-minute consult with either Dr. Jeremiah and myself. We will take the time to see if we can help you overcome your issues. Thanks for joining us, and we look forward to talking to some of you.